Good morning. So today we'll be discussing a case of correction transplant surgery that we had done somewhere in 2022. So this patient had done the surgery from somewhere else, and he was saying that somewhere around 4,000 grafts were transplanted in his frontal and vertex area, and we could see that the growth was not optimum. The patient was really unhappy about the results because the way the grafts were transplanted, the direction was not correct, and even the growth of the grafts was not optimum. So what we planned for him was correction of the hairline. So we could not remove the complete grafts which were placed in the hairline. So what we did was we transplanted the hair in such a way that we could make the hairline look as natural as possible with whatever few number of grafts that were available in the donor area, because in the first session itself there was a lot of damage to the donor area. So we could remove just 2500 grafts from the donor area. So as you could see that the hairline was the direction of the grafts in the hairline is not proper, and you can see that the growth is not optimum according to the number of grafts. The patient is saying that he had done 4,000 grafts, but the growth of the grafts is not optimum, and the direction is also not correct, because of which he is very unhappy about the results. So while planning the case, what we did is we could remove a few grafts which were really abnormal in the direction. So we removed those grafts, and then we placed the grafts in such a way that the correction and the balance would come to make it look as natural as possible. So these are the results, how he had progressed through a few months, and probably 8th month or 9th month is what he sent the pictures, and then we could see that the hairline is restored and the grafts also had grown. So this is what we could achieve in somewhere around 2500 grafts which were available from the donor area to make it look as natural as possible. So what we can take from this case is that people, when they claim to do more number of grafts, say suppose 4,000 grafts, 5,000 grafts, 6,000 grafts, is not actually required. So this is what they would be claiming to sell lucrative packages to some people, and they fall trap to this, because what we see is there is a lot of damage which happens in the donor area, and the recipient area also doesn't respond so well. The grafts don't grow so well. So beyond 3,500, 4,000 is not we do in a day, and that much is not required also, because here the survival of the grafts, the transaction rates in which the grafts get damaged, all these factors come into play. So it's always better to do it in 2 sessions and all, if somebody is saying like that. And the number of grafts, the number of follicles, the number of hairs should be clearly discussed with the doctor, and the planning and everything should be proper when you are going for a transplant. So these are the things you are bound to, the doctor is bound to explain.